4. Okay.
Okay. So basically, I will ask you the question, but just give me 2 seconds before answering so I can mute myself on my end. Okay? So first of all, I will start recording. Okay.
This meeting is being recorded.
Okay, so first question. What is long COVID?
Okay. So we know all about, we've all heard about COVID as a very multi-system disease which is caused by the coronavirus version 2. We've all heard how it started in China, how it's come across to the rest of the world, and it has been through every country in the world. So most people with COVID generally have a illness which lasts between 10 to 14 days. Once the people start recovering from the initial symptoms, it takes up to 4 weeks for a complete recovery to happen, sometimes a little bit longer in some people and a bit earlier in some people, but an average. So anything that lasts more than a month is considered to be post-COVID, and the post-COVID symptoms can continue for up to 3 months. And by that time, we expect that almost everybody who's had COVID would have recovered fully from the symptoms. Therefore, at present, we define long COVID as someone who has symptoms still persistent even after 3 months have occurred. So that is what a definition of long COVID is. And at that point, we know that up to 10% of patients tend to continue to have symptoms. How long those symptoms lasts, we don't know fully, but up to a year, 6 months to a year is expected. And there are some people who tend to have more risk of COVID. So we know that women in the age of 50 to 60 tend to have more likelihood of continuing with symptoms. We know that men who are above 70, who've had a very tough illness at the beginning, tend to have more symptoms, maybe up to 20% of them. And also there's a group of people who've had very mild illness, so who are in their 15 to 30 age group, so young people, young women mostly, who tend to have continuing symptoms, although their original COVID wasn't as serious as that stage. So 10% on average, 20% in some groups, lasting more than 3 months.
Okay, that's question number 1. Now, while we're speaking, those will be cut off. Okay, just show you. Question number 2. What are the most common symptoms of long COVID and how is it diagnosed?
It's a very interesting question. So if we think about what are the symptoms of COVID that we know of? We know that in the beginning of COVID, it's fever, cough, breathlessness, are common symptoms, and also loss of sense of smell, loss of sense of taste are the sort of primary symptoms. Along with that, people report flu-like symptoms, so body ache, feeling extremely tired, having a lot of headache, and sometimes, rare though, there are symptoms of diarrhea, vomiting, sometimes confusion, especially in people who are older, and some people get other system involvements like liver problems, kidney problems, or heart problems. So chest pain, for instance, is common. Now, these are all in the beginning. Now, we know that people who have breathing difficulties, people who have a lot of fatigue, and especially people with smell, a loss of sense of smell and taste, are the ones who tend to have consistent symptoms persisting more than 3 months. So in long COVID, the number 1 symptom is fatigue. So people are feeling exhausted, fatigued all the time. So that's number 1. Number 2 is some people experience breathlessness. So they continue to have some degree of difficulty in walking around and feeling breathless, especially climbing stairs or doing activities which they had done easily. So second big symptom is continuing breathlessness. Some people have an occasional cough, sometimes a bit of chest pain, which doesn't last a long time, but just occasionally they would get that. So those, and also persistent difficulty with getting your sense of smell back or the sense of taste back continues to be a problem. So the appetite can be affected. But those are the main symptoms overall. Now we must think of another group of patients who tend to have significant COVID. So people who've been really having lung involvement with COVID, who ended up going to hospital, perhaps needing a period of time on oxygen, perhaps also needing some period on ventilation, tend to have some residual sequelae of the disease. And that involves having lung fibrosis and sometimes collection of fluid around the lungs. So that is not long COVID. That is just, post-COVID, respiratory distress syndrome. So those patients we will be following up very closely, and they are the ones who will continue to have problems from residual problems from COVID. Long COVID are people who did not have any of those serious illnesses at the beginning, but tend to have fatigue and breathlessness. But when you look at their lungs, actually the lungs don't show any signs of scarring. So there's a slight distinction between, post-COVID lung problems versus long COVID.
Okay, perfect. Just a comment, Professor. Sorry if for me as a listener. Okay, so for example, fibrosis. Not everyone knows fibrosis. So for example, those technical words, medical technical words, we tend to recommend switch them into a more street-like words, more familiar to the patient. So instead of saying fibrosis, scar would be, for example, a better substitute. Okay, so just to simplify the information as much as possible for the patient. But other than this, perfect. We can move on to another question.
Okay.
Is it possible to treat long COVID, and can people with the condition recover?
Okay, so can we treat long COVID, and do patients will, with long COVID recover? So we believe that patients with long COVID will definitely recover, and we expect that we don't know exactly how many will recover, but we expect that the vast majority of patients will recover and will no longer have symptoms after this, after that period has passed. What we don't know at present is how long, and there are lots of individual variabilities on how long the symptoms will last for some. If we think about other viruses that cause post-viral fatigue syndrome, for instance, you will know that some people have symptoms up to 6 months, but after 6 months, most 90% of people perhaps would have recovered fully, and we don't believe that post or long COVID would be any different from that, and we're expecting that by 6 months, 90% of people would be recovering fully. And then any ones who are still having some symptoms up to a year. Now, the second part of the question is, what treatment do we have for COVID? So certainly, one of the things that people ask, and we also consider as doctors, is, does long COVID mean that COVID virus is still around, and are we still infectious? At present, there is no evidence that this is persistent infection. So there's no risk to infection to others. There is no evidence that there is virus particles that are already present. And all tests for COVID are usually negative. So it's not concurrent infection or ongoing infection. So what we know is these are the effects of COVID now that it's gone, which is still continuing. And treatment, there is no specific treatment at present. So we try to treat symptomatically. So if someone has breathlessness or fatigue, we tend to check to see whether the lungs are all right. So we would do imaging of the lungs. So it could be an X-ray, it could be a scan. And we would want to make sure that the lungs are okay. We also want to make sure that there are no clots in the lungs. And once we know those are okay, we would want to do some exercise tests, so simple walking, climbing stairs, going on the treadmill, just to see whether during exercise, whether the oxygen levels are adequate. In most long COVID patients, the oxygen levels will be fine during these things. And then we talk about the way to manage this would be rehabilitation. So it will be about having graded exercises, which will be done on a regular basis, sometimes done, if possible, in a group. So, 2 or 3 people working together with somebody guiding them, usually a physiotherapist or a personal trainer,